Joining us now is the White House Coronavirus Response Coordinator, Dr. Deborah Birx, who also helped lead the fight against the global AIDS epidemic for more than 3 decades. Thank you so much for joining us this morning. We heard the president and also in Whit Johnson's report, and we heard a change in tone in yesterday's briefing and stricter restrictions right now. What led to that, Doctor?
Well, our job every day in the task force is to bring the most recent data, our most recent scientific evidence from around the globe, and all of the new models that we've been working with modelers on to really understand what elements of mitigation at the community level could have the biggest impact on stopping the spread of the virus. Really, again, to protect our older generation and ensure that they don't become infected. And
that is paramount. We saw in Whit Johnson's piece also what the president was talking about, and we hope that you can give us a little clarification when he said that the emergency mode, as he put it, washing through by July or August. What exactly does that mean?
Well, it's really important to look at the scientific evidence that we have available right now. When you look at the China epidemic and you look at the South Korean epidemic, you can see the duration when you reach peak and how long that peak lasts and when the number of cases start going down because of the efforts you have made. Now, when we talk about, I just want to be clear, the efforts that we're talking about, because as you covered just now, we don't have a vaccine yet and we are still working on therapeutics. So the one effort we can have is every single American taking responsibility and making those sacrifices that you covered also in the first segment.
And you believe the key right there, millennials. Why is that?
I do. When you look at data, it's very important to integrate both health data and public health data and cases with census. And if you look at every large city across America at the census bar graphs, you'll see that in every single case, the largest numbers, about 22% in many cities, are millennials. The millennials are incredibly good about getting information out in a clear way, but more importantly, they are incredibly good about understanding how to protect one another, how to protect their parents, and how to protect their grandparents. Right now, we need the army of millennials out there doing everything that they can to protect themselves from getting infected, because we know a lot of their cases will be mild or asymptomatic, and making sure that they're doing every single precaution to protect their parents and grandparents.
That's an excellent point there, Dr. Birx. And as we said, and thank you for this, for decades you have led the fight when it comes to AIDS, and we appreciate the work that you have done. How well do we know? Can you assess this virus for us? How much do we know?
Well, we know a lot more than we knew in the early days of HIV. Those early days of the early 90s, when really the only ones really out there and fighting for one another and for what they needed were the people who were at the greatest risk. You know, it was really inspiring to me to watch people who were sick themselves going to the street, not because it was going to help them, but because it would help the group coming behind them. They were already too ill. I guess that's what I'm asking every American to do now, to do whatever they can to help the Americans ahead of them, to make sure they don't get infected.
Oh, well put. Well, Dr. Deborah Birx, thank you very much. And I know that we will be checking with you from time to time, and we appreciate you giving us some time this morning. You take care. Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.